Hi everyone, welcome back to Ostomy Care with Angel Face Amy. I'm Amy, your ostomy nurse, here to show you today an actual demonstration of a total pouch change. So I was meeting with one of my patients today, and she said she had watched my videos and she still wasn't really sure how to use the deodorizing lubricant. She was having some trouble with pancaking, and she thought maybe this would help, but she really wasn't sure what I meant when I said to put it in the top of the pouch. So I'm actually going to do a little demonstration today, and we're going to apply a whole appliance today just to give some tips and tricks and hopefully help you get your appliance to stay on well for at least 3 days. So when you do your ostomy appliance change, you're going to want to make sure you have everything that you need on hand. So everything right by you. So you're going to want to make sure you have some wet paper towels and some dry paper towels. And then if you have some irritation around your stoma, you're going to use your stoma powder and your skin prep. If you don't have any irritation and your skin is totally intact, then I recommend just using nothing. Just apply your appliance without the skin crusting technique. But because this seems to be really popular, I'm going to demonstrate all this again. So I'm going to apply my little fake stoma again. So we're going to pretend like this is my stoma and this is on my stomach. So the first thing you're going to want to do, like I said, make sure you have your wet towels, your paper towels, you're going to dry towels. You're going to take off your bag and then you're going to throw it in the garbage. And then you're going to want to make sure you just clean around the stoma, clean the stoma. This is not like an exact science. You don't need to get everything totally perfectly clean. You just want to use warm water and you just want to make sure the skin around the stoma is nice and clean and dry. So we're going to pretend like I have some irritation around my stoma. And if I did, then I would want to take some stoma powder and sprinkle it around the stoma. It's okay if powder gets on your stoma. It won't hurt anything. This powder actually helps things heal and everything. So you're going to sprinkle it on, and then you're going to brush off any excess powder. It's going to stick wherever you have irritation, and you're just going to brush off all the excess. So once you get that done, then you're going to take one of your skin prep pads. You don't ever want to apply an ostomy bag directly over the powder. It won't stick well. It will definitely cause you problems. So after you get the powder on, you're going to take a skin protectant or skin prep pad, and then you're going to seal the powder in. And you're going to just dab it around and seal the powder in all around the stoma so that way the appliance can stick. So, in real life, this stoma could be squirting out poop or pee, whatever, anytime, and can't control it. So always make sure you have your dry towels ready on hand. So the next step now, after I got my peristomal skin all protected and ready, I'm going to take one of these measuring guides. This is if you have a new stoma that's changing sizes, and you need to measure to figure out what size we need to cut the hole. So if I take this little guide, I'm going to find the closest one, and this one seems to fit pretty good right around that stoma. So that one is 35 millimeters or 1 3/8 inch. So if you look on the back of the appliance, there is a 25 and a 35 on this one. But on the back of this one, it tells you 20, 30, 38, and the 1 3/8 is actually measured out on here. So we'll go ahead and we'll use this pouch to, so you're going to take your scissors and you're going to go up to the 1 3/8 line, and you're going to go through the middle, and then you're going to cut the pouch. So I'm just going to go around that line. You cut on the outside of the line. Theoretically, this should fit right over your stoma. You just want to have it a nice close fit. It doesn't need to be perfect. Like I said, nothing is an exact science. You want like less than 1/8 of an inch of skin showing. These bags are kind of cool. They are all opaque, so you can't see, but they're designed to kind of be ripped right here. And then you can pull it apart and you can still see in when you're applying this onto your stoma. So we'll see if that fits. So that's actually a little too tight. We don't want it rubbing on the stoma. So I'm going to go ahead and cut it slightly larger. And we're going to hold it up again and make sure it fits before we do anything else. So now we're going to take this and we're going to apply this on. Okay, and now that fits right around the stoma. I don't know if you can see it, but it fits right around it nicely. There's just a little bit of excess skin around the edges that are visible, but not much. It's a nice close fit. So you don't want this to be like rubbing on the stoma. You want it to have a little bit of room, but you want to protect as much of the skin around the stoma from the poop as you can. So once you do that, then we're going to actually open up one of these deodorizing, lubricating packets here. And so what I was trying to say before and trying to explain is that you can take one of these or your bottle of this, whatever you have, and you can squirt some right in the top here. And then you can use the rest of it in the bottom of the bag, or you could use the rest of it another change, but you put it right on the top and then you kind of mush it all around the bag on the top, because that is where poop first comes out and we want the stool to be able to slide down the bag. So I'm going to make sure this bag is closed before we apply it. And then, so now we have our bag all ready to be applied. And we have the lubricating gel all up here on the top. So it kind of just gets stuck all in the bag here, and it's just making the top part of this bag nice and slippery. Okay, so the other thing is you want a little bit of air in here. So you see how it's kind of pulled apart a little and it's not sucked down. So then you're going to take off. This is like a, I always say it's like a template for the next time, so you know what size you cut it. And then you're going to, when you do this on yourself, you're going to want to be able to see in there, so you can see over the stoma. You can see inside there and make sure you get it on there good. And then once you get it applied onto your stomach, on your stomach, you're going to want to make sure you keep your hand over the pouch, because your pressure and the warmth of your body is what helps activate the adhesive so that you get a good seal. So don't get up right away and walk around. You want to make sure you are sitting down for a good 5 minutes after you apply it, so that way it will really get a good adhesion before the stool starts coming out, and you'll make sure that you aren't going to have to deal with leaks, and this should last you then for 3 days. So this is a good way to make sure you get a good seal. So now this is like really nice and stuck on my hand. So then when the poop starts coming out, hopefully it's going to slide down into the bag and not be all stuck up here, causing that pancaking problem. So that was a demonstration of exactly how you apply a new pouch. And hopefully that helps for all you new ostomy patients and caregivers. I think I'm also going to do a demonstration of a 2-piece another time, and maybe I can show you the difference between why some people prefer a 2-piece and why some people prefer a 1-piece. But that is it for the demonstration of how you apply appliances, and I hope this video was helpful. Make sure you hit the subscribe, and please submit any questions or comments you have, because I'm happy to answer them. And maybe you have an idea of something that I can do a video on that will help more people. So I love when you reach out to me, and we can all kind of try to help each other. Otherwise, I will see you next time.